Thank you very much, James. And my name's Nigel Acheson. I'm the Regional Medical Director for NHS England across the South region. And just before I start, I'd like to add my thanks to James, to Caroline, Jessel and Amy for giving me the opportunity really to get involved in this agenda. And it's really strange, like James, this conference is the second I've been to of these, and it's a completely energising thing to be involved with, helping to organise, and certainly I've been looking forward to this for absolutely ages. So thank you. What I wanted to talk about was a little bit more about the context from an NHS England point of view, about where some of the work that you're involved with sort of fits in, and how we take responsibility for trying to make sure that there's visibility of that work, support for that work, and hopefully development and expansion of it. The background to these sustainability and transformation plans really was a document called the 5-Year Forward View. And I think it's worth understanding that was written because various of our national colleagues could see the writing on the wall for some of the challenges that the health service was likely to face unless we started to do things differently. And one of the things that was noted was the quality of care can be variable. Yeah, we know that. We're desperately trying to address that. But actually, the huge scale, if we don't manage it, of preventable illness. And the idea that actually the needs of us as members of the public, hopefully in trying to keep healthy, stay healthy, prevent illness, those needs are changing. And that there was an acknowledgement in that 5-year forward view that actually what we needed to do was make changes collectively to the way that we live, how we access care and support, and how care is delivered. And underpinning that, I think I would term that as being building resilience for individuals, building resilience for communities. And then the development then of these STPs allows us to articulate that in a slightly different way, because what we're talking about are collections of organisations, health, local government, third sector, to look at providing for populations on a geographical footprint. And so this is a huge opportunity for us, articulating how we maintain our health and well-being. And I'm really very conscious of that, having turned 50 this year, and being to a lecture from an elderly care physician who told me that if I maintained a sedentary lifestyle, I spend a lot of time on a train, that my muscles will gradually just waste over the next 10 years, and then the 10 years after that. And if I don't do something active about it, by the time I am in my 70s, it will be much more difficult for me to maintain my balance, my independence, and so on. And so there's a real need for me and others of my age to really take this seriously. You've seen the map. So these are the 13 footprints. You will be able to work out, hopefully from the map, which of those footprints you sit in, upon which we would like to help the leaders who are planning services in those footprints to think very carefully about how, as James said, we play the wider sustainability agenda into their plans. Excuse me, and in support of those leaders within those areas, a number of guides and supporting bits of supporting information have been produced, one of which is around sustainability itself. And we believe, and we're working with the STP leaders to try and help them see that it's not just the financial imperative that they need to consider if we're going to build these STPs. We need clinical, we need environmental, and we need social thinking in terms of how we make our change. I talked a little bit about this very high-level strategic thing. There are a number of different ways that this is beginning to come into the collective consciousness of us all through the health and care system, this idea that prevention, this resilience, and building communities is important. And the number of them are on this slide. But the NHS England strapline is one that I cling to because I think it speaks to us all. It's high-quality health and care for all now and for future generations, and that really allows us to begin to describe the wider role that sustainability can play in planning for our future together. And there are some legal duties Public bodies are required to consider how the services they commission and procure might improve the economic, social and environmental well-being of areas. And I think these are things that are beginning now to be raised up the consciousness of our leaders in a way that I don't think has necessarily been done previously. And it's a convenient truth, actually, that what's good for creating a sustainable future is also good for health and healthcare now. So for the public's health, things like more physical activity, a better diet. We've heard a little bit about the importance of diet, improved mental health. We're beginning to be able to talk about mental health now in a way that's been very, very difficult for us in decades past. This idea of parity of esteem, less trauma from the roads, air quality, something that many of us, my children, talk about air quality, less obesity, heart disease, cancer, more social inclusion, etc. But for the healthcare system, we genuinely now understand that we will not be able to be the receivers of that water coming out of the tap unless we begin to quite rapidly turn off the flow at the top end. So prevention, trying to support people to manage their own conditions where possible, and if not, manage their care much more close to home. I mentioned this empowerment, self-care, the better use of drugs, using evidence to do that. Information, we've got the opportunities which are now mushrooming in terms of how we use IT to support ourselves. We need better models of care. For those of you who haven't had a chance to read it, I commend to you this report published earlier this year by the King's Fund, describing gardening as an intervention, the opportunities for social prescribing. We heard about community gardens, volunteering, helping us to recover from illness. But actually, there's some very specific things, thinking of myself as I grow older, gardening in terms of helping falls prevention, and we've also heard about its role in dementia, and there have been specific projects looking at the use of gardens in end-of-life care. Being slightly hard-nosed about it, there is a financial benefit to taking this agenda very seriously, and this is one of the things that we're using in our discussions with our colleagues. It's been estimated that increasing access to parks and open spaces could reduce the cost of treating obesity by up to £2 billion, and obesity and diabetes are two of the most enormous public health issues that we need to confront, we need to manage, we need a plan. The other thing that I really liked was this work on London, suggesting that the tree cover, including gardens in London, produces this wide range of benefits, not just carbon storage, flood alleviation, but an amenity value which has a value to it, of more than £130 billion. The green gym, the return on investment for the green gym, which many of you in this room will be familiar with, is another lever that we can use. And we've already heard a little bit about how access to green space can help improve our mental health. And just focusing a little bit about mental health, this isn't something new. We've been using exposure to green spaces and gardens in terms of mental health right from the 1830s is some of the earliest evidence. But there is this evidence, as I say, which accumulates, which suggests significant reductions in symptoms of depression and anxiety, enhanced emotional well-being, improved social functioning, physical health, and opportunities for vocational development. For those of you who are familiar with Exeter, which is a lovely city that I moved to some 12 years ago, this is the Devon Hotel, which is on the outskirts of Exeter. And the Devon Hotel almost always has the most amazing display of flowers outside it, which I hope you can get some sense of from these photographs, although they don't really do it justice. But this is where these beautiful floral displays start, and in fact this is the next lot for autumn and winter this year, and a bit more of the plants being grown in a commercial setting. And this, we talked a little bit about orchards, and this is an apple orchard, and my one regret, and I do apologise, is that I forgot to bring a bottle of the apple juice that is produced from this orchard, but I can promise you it's absolutely delicious. Some younger trees, and the ground fading away there towards the excess tree, and that's a little pear tree, and I can absolutely assure you those pears were delicious on the day that I was there. And I'm absolutely delighted that Don Crispin, who runs this facility, is in the audience today, and that's him, master of all he surveys. And he works for an organisation called New Leaf. And New Leaf is part of Devon Partnership's vocational rehabilitation programme. It's been developed for many, many years. It offers individuals the opportunity, if they want to get involved, of doing a meaningful and productive activity, of rebuilding their self-confidence and self-esteem. It develops communication from being part of the team with other people, improves stamina, gets them back into a routine, gives them that sense of purpose, and improves physical and mental health well-being, and also prepares them to get back into employment. And in addition to the Hillcrest Growers, which is a commercial wholesale retail plant nursery, there are other elements that have been developed within the New Leaf programme over the years. Woodwork, clothing works, and a print facility, and also a cafe. And this is a picture of the woodworking facility, just absolutely amazing quality of work that goes on there. The clothing part of it. And this is a quote from one of the people who has accessed the New Leaf facility. I'm going to read it out for you because I think that it speaks to a lot of what many of you and we believe, which is something special about New Leaf. All the staff are just so supportive and nurturing in terms of your own recovery. But for me, essentially it was during my time there that I rediscovered my self-worth and conviction, something that no medication nor artificial mind can ever replace. And in fact, on the day that I visited, Don had a letter from somebody who had been through New Leaf, and they'd written some years later to say that the confidence that they'd gained through their participation in some of the projects at New Leaf had allowed them to have the confidence to go to university and get a degree. And they were writing just to let Don know that, in fact, they'd completed that degree course and been awarded their degree. The Royal College of Physicians and the Royal College of Child Health produced a report called Every Breath We Take, which is a publication on the impact of air pollution. And one of the things which will come as no surprise to, again, to members of this audience is that it's often the most vulnerable who suffer harm in these circumstances. The very young, the very old, those with long-term conditions, and particularly those that live in deprived areas. And there's a cost to that. And the cost can be measured in terms of premature mortality, 40,000 deaths a year, and a financial cost, £20 billion. And we know that air pollution plays a key role in climate change. So what can we as individuals do? Well, we can try alternatives to car travel, and there are many examples of how that can be done on some of our stands today. Take the active option, bus, train, walking, cycling. We can aim for energy efficiency in our own homes and lives, and I know that some of the behavioural interventions that many of you are involved with at work are trying to spill out to our homes as well. And this year, as part of my interaction in this work, I've become an avid cyclist again. You'll be relieved to know that doesn't involve any lycra at all. But this is the first part of my commute to work. So cycling down to the local railway station, I have to say the view over the estuary is life-affirming every time I see it, and it's been fantastic. I'd also like to thank my colleague Paul Durrans from Oxford Academic Health Science Network, who has joined us today, and also not only for the work they've done, but help in producing the slides to talk a little bit about their sustainability work, which involves both wealth creation, but a number of strands of work involving benchmarking on sustainability, sustainable transport, solar opportunities, sustainable food, changing cultures and behaviours. So they've done some benchmarking to show what the opportunities are, both in terms of ways that we can reduce the impact that we have on the environment, but also save money. They work with a number of partner organisations, a number of our trusts, and there's a financial impact to the work they do, a benefit, savings which are tangible and recurrent. And they've done work supported by the Carbon Energy Fund. And these savings are savings which can accrue over a relatively short period of time through the work that they're doing. And as I say, I'm immensely grateful for the work that they are doing and hope that we see that expanding. And just looking very briefly at some of the elements of the work that they're doing, the Culture Change Programme, as I say, there are some real tangible savings that can be made through this work. the fact that 5% of the road traffic in England is attributable to NHS-related travel, which is responsible for 13% of the NHS carbon footprint, and ways that we can try and reduce that impact through some of the work that colleagues are promoting, opportunities for other sorts of energy like solar. And we talked a little bit earlier on about food, sustainable food production, food for life, working with the Soil Association, how we can make that a reality in our everyday life to the benefit of patients and the wider public. So just two small examples from our patch of the sorts of work that's going on. Thank you very much for listening. I hope that, like me, you're looking forward to the rest of the day, and thank you.